my name is Michael, and I'm going to be talking to you about precision and predictive medicine as my TeachOne assignment for HAP 360. Um, the purpose of this assignment, the purpose is to analyze data and find out which drug is the most effective to treat anxiety based on the genetic and phenotype factors, to organize data and predict treatment success. What is precision medicine? Well, according to the National Institutes of Health, precision medicine is an emerging approach for disease prevention and treatment that takes into account individual variability in genes, environment, and lifestyle for each person. This approach will help physicians and researchers to predict which treatment and prevention strategies will work to treat patients for a particular disease. An example is DNA testing for cancer. What is predictive medicine? Predictive medicine entails predicting the probability of disease and taking steps to either prevent the disease altogether or significantly decrease its impacts upon the patient. This approach uses genetic testing to determine a person's risk to developing a disease, for example, prenatal testing. So as for the assignment, part 1, it wants us to create a table showing the relationship between anxiety diagnosis, which is the data in column with heading of generalized anxiety diagnosis, and response to citalopram, which is data in column with heading of CIT success. So it wants us to report the rate of success for citalopram among patients with generalized anxiety depression. So how do we do this? First, we get the data that's provided with us in the Excel sheet. In the Excel sheet, you're going to see a lot of ones and zeros. The zeros indicates that the drug had no effect, and ones indicates drug was effective. So let's go to our Excel sheet, the data they provided with us. First thing you want to do is click on Insert, then click on Pivot Table. It highlights the whole data. Then we're going to OK it. And it gives us a blank table. In here, what we're going to want is the anxiety diagnosis. So I'm going to type in general, and you should see general anxiety diagnosis. We're going to put that in our row labels, drag and drop. And right after that, we want the first one, which is CIT success, which should pop up. Drag into the columns, and again dragging it to the values. Now, default is sum. We don't want the sum. We're going to want the count. So change the count from sum to count. Okay. So now we got different values. Now we're going to want to find the rate of success. Rate of success. To find the rate of success, what we're going to do is we're going to divide the success individuals, which is 117, divided by total individuals, which is 366. Enter it. It should give you a decimal number of 0.319672131, or in other words, 32%. That's the rate of success for the CIT. So the rate of success of citalopram, the answer is what I said earlier, 32%. That was for the first part. For the second part, it asks which medication has the highest success rate when the patient has anxiety diagnosis, and it wants us to get the same format but for different drugs. BUP, SER, VN, CT, MIRT, and NTP. Wants us to report the rate of success for each of the medications. And also give your opinion about why is it difficult to understand which medication works for patients with generalized anxiety depression. Well, in my opinion, everyone is made differently, so certain medications work differently for others, while other medications might not work at all. Alright, so to get the rate of success for the other drugs that was asked for, we do the same steps. I went ahead and did it in advance. And for BUP, the rate of success is 0.206. For CIT, the rate of success is 0.319. MIRT is 0.125. And the rate of success for CT is 0.2. NTP rate of success is 0. And SCR rate of success is 0.269. The rate of success for VEN is 0.131, which was the last drug that it asked for. So which medication has the high success rate to treat anxiety? Based on the chart here, with the rounded percentages, rounded decimals, CIT has the highest success rate of 32%. Now for part 3, it asks which medication has the highest success rate when the patient has substance abuse. So instead of generalized anxiety diagnosis, we're going to use drug abuse diagnosis. So we're going to go back to our data, and we're going to create a new sheet, so new pivot table. Okay, so there's a new table. So instead of generalized anxiety diagnosis, we're going to type in drug abuse diagnosis, which is right here. It goes in the rows. And again, I'm going to start with CIT. Put it in the columns and the values, drag and drop. And don't forget that sum. Change that sum to count. Don't forget that. Oops, I removed them. My bad. Trying to show off here. Yeah, so change the sum to count. Alright. And again, we're going to get the rate of success. Again, to get the rate of success, you click on success individual divided by the total individuals, and gives you the value of 0.313 043478. And I went ahead and did an advance for CIT, which is the same number, 0.313 043478. MIRT is 0, the rate of success. For CT is 0, and for NTP is 0.1428, 57143. SER is 0.22222, and VEN is 0.1428, 57143. And last is BUP, which is 0.375. And so which medication has the highest rate of success to treat substance abuse? And the chart here I have with the decimals rounded, 0.38 BUP, which is 38%, has the highest rate of success. And so hopefully everything, hopefully I was understandable, and hopefully I was able to help out with this assignment. And good luck. Thank you.